Now we will discuss about periprosthetic fractures in short. We're not going to discuss about these fractures in detail, only basic principles and management. With the expanding use of arthroplasty as an effective procedure for osteoarthritis of the shoulder, hip, knee, and ankle, periprosthetic fractures have become an increasingly clinical problem. The combination of fractured bone with an existing prosthesis makes these fractures challenging. When the femur is involved, the periprosthetic fractures are associated with a high risk of mortality. The mortality rate within 1 year following a surgical treatment of a periprosthetic femoral fracture is high and is similar to that after treatment for hip fractures. The basic principles of managing all periprosthetic fractures is as follows. If the stem or component is loose, a revision of the component is indicated with the adjunctive stabilization of the fracture with a plate or allograft or a plate composite. If the stem or component is well fixed, the component should be retained and the fracture stabilized with a plate that is augmented with the cables and or allograft support around the stem. In periprosthetic fractures around total knee components, the distal femur is the most common fracture site. Around the knee, periprosthetic fractures are more frequent following revision arthroplasty than after primary procedures. It was once thought that notching of the distal femur during a surgical preparation for the femoral component was a major risk factor for subsequent fracture, but this has proven not to be the case. These basic principles hold for fractures around humeral stems in shoulder arthroplasty and for periprosthetic fractures around the femoral stems in total hip arthroplasty. With the periprosthetic femoral fractures, plate fixation where screws can be placed around a well-fixed stem provide the optimum biomechanical solution. A combination of a non-locking plate with an allograft strut resulted in the highest stiffness of the constructs examined for treating a periprosthetic fracture around a stable femoral component of a total hip replacement. Locking plate or a regular plate for the periprosthetic fractures. Locking plates don't appear to provide a better mechanical solutions than other plate types in the setting of periprosthetic femoral fractures occurring at or near the distal tip of a prosthesis with a stable femoral stem. Despite the potential to preserve the cement mantle, the locked screw did not appear to offer a good pull-out resistance. But the locking plate is good for fixation of a periprosthetic fractures around the knee joint. In a rare situation with a significant bone loss associated with the periprosthetic fracture, endoprosthetic proximal femoral replacement is a viable solution. Coming to the conclusion, these fractures are becoming more common nowadays. These fractures are difficult to manage because of the poor bone stock, implant, osteoporosis, old age, medical problems, and these fractures are associated with the high complication rates, and we have to follow the basic principles of fracture management with an implant for a better results in this group.